Hello, Dr. Sayeedi, you're on.
Yes, how are you?
Good. How are you doing?
Good. Good. So, uh, we are discussing about uh, protocol in future about in dentistry. Oh, first, let me introduce our technical and sales director, Arcline Lab, and thanks for your invitation here. And so, would you want to continue?
Sayeedi is one of our biggest producer for Western Dental. We restored a lot of cases with him, so we have a lot of experience and had become friends. So we basically want to get on this Zoom meeting just to inform everyone what's going on, what we're doing, and the future of dentistry.
Exactly. Yeah. So, yeah, I've done so many cases with you guys. I mean, initially I started with other labs, and finally I ended up working with you guys completely.
Nice.
Yeah,
Right.
thank you. Thank you for
Yeah.
this.
Thank you. So I
The
do.
whole staff, everyone is nice.
Thank you. Thank you. Yes. And then our platform, right? Our Arcline platform is in every Western Dental office before this pandemic happened. So it's a software that we wrote that helps track all the cases, see what the relationship between us and the dental staff in each office are doing with analytics and metrics to measure everything.
Mhm. So, my practice limited to implantology only, but right now, today, I'm going to discuss about all aspects of dentistry.
Mm-hmm.
Okay.
Right.
So what's the new information? Like, are we gonna have vaccine and everything?
I believe there's already a vaccine out there.
Yeah, but if vaccine out there, why people are dying? Still dying every day.
Yeah. Yeah.
So and it's right now we are at the peak in USA.
Right. Right. And especially where we're from, we're in San Jose, California. Santa Clara is basically still shelter in place. So Gavin Newsom said we're in stage 2, but Santa Clara is still shelter in place because we have a high rate of COVID in this area.
Same thing here in Sacramento. But look at where I live. It's a small town, Elk Grove, and population is huge. But the total number of cases are 100 only, 96 or 97. So less chances of getting this virus, but it's dangerous. We have to be very careful.
Right. Right. Yep.
Mm-hmm.
Going back to work this whole time and shelter in place, I've been in a lot of Zoom meetings and getting the lab ready for business. So we've spent quite a few dollars on UVC lights, PPEs, going the extra measure to protect our employees and ourselves of the virus. Because if someone in the lab gets sick, basically everyone has to quarantine themselves for 2 weeks and basically shuts the whole lab down again. So we're
Definitely, I would like to know more about what your lab is doing in order to protect our patients, because most of my work goes to your lab, actually all. So, and like last year, I did almost over 1,000 restorations. So I want to make sure, like, where I'm sending all my cases, that lab should use complete protocol and like to protect our patients and even us.
right. Right. I could say we work with a lot of hospitals as well, along with DSOs, a lot of
Mhm.
universities as well. So we already treat our cases, like Valley Medical we work with in San Jose. We treat each case as it has AIDS on it, right? So
Mhm.
we don't know the patients going into those hospitals. And like for yourself as a professional, you can't assume. So we basically assume every case has AIDS and all the OSHA protocols are abide by. But since this pandemic happened, we went above and beyond that to have the correct PPE on top of what we were doing to keep ourselves extra safe. So even our pickup delivery and laboratory are in two separate buildings. So we have one area where everything gets disinfected and it goes to another room to be processed. From there, it's sent out to be shipped or go to the laboratory.
Mhm.
So we have
Mhm.
protocols in place, but since this has happened, we went above and beyond protecting our patients for you guys.
Yeah. I don't know when we are going to stop this N95 thing all with like whole day. It's like suffocating.
It,
And like I work few days for in private office for my emergency patients, and it's suffocating like whole day. N95, it feels like it's impossible.
I believe that the regular mask, the stage 3 mask, works just as fine. That's some of the news that's been out. So surgical mask, stage 3 is fine. It protects you 95% of the time, like N95.
Mhm.
And on top of that, we also put a face shield. Our office is
Yeah.
actually putting 2 of the surgical masks, but at the same time, it's restricting your air.
Yeah. Face shield is like we have so many different types of face shield, especially what we are using in Western Dental. It gives me headache right here on temple when it presses down here.
Right.
It gives me headache. So I don't know. I mean, we have different types which goes in the middle of the head, and it's so comfortable, but it's still changing and sanitizing like every after each patient. It's difficult. It's very hard.
Right. Right. I believe that uh, protocols are already set in place, but I think as
Mhm.
far as the dental industry, it seems that we got to relax on things, right?
Yeah,
Meaning
yeah,
that it was always there. It's just we never did it, and we wear the watches, we wear the jewelry, right? And that's something you can't do nowadays. You can't wear jewelry. You got to keep your office, your operatory clean, full of clutter. No magazines, right?
yeah.
Um, so it's changed. It's definitely changed.
Mhm. Why don't we start our slide like which you made uh, with Dr. UNO,
Yeah,
and he's periodontist in San Jose, right?
yeah. He's a very good periodontist in San Jose, or actually in
He
Campbell.
get mhm. He
And
gathered very good information. Like so let's discuss that. I mean, this is very helpful for all the doctors and everyone.
sure, let me share my screen. So we have a Zoom meeting. We kind of meet every week, actually,
Mhm.
and it's on Facebook. And he shares what he's learned, and he's part of the Spears think tank with Dr. Imtiaz, and really good information. And a lot of people chime in on Silicon Valley COVID-19 Facebook and
Mhm.
talk about what's going on. So I'll
Mhm.
present some of the slides that he also presented, I believe, last week, and a
Mhm.
culmination of stuff I'll put in here that we've done as well.
Mhm.
So let me start this. So basically, training and educating your team, right? You want to make sure everyone in your office knows the protocol. Being Arcline, we're almost a technology company, software company, so we have a lot of SOP for everything, standard of procedure. So everything we do, it's a recipe. So like when a patient comes in or a staff comes in, we measure with a laser no touch thermometer. And if it's 104 and above, you basically have to go home.
Yes.
Make sure you wash your hands. Make sure you use hand sanitizer right before you come in, because we've counted an average of when we left the house, got in our car, unloaded, got into our office. So we've touched about 30 different things. So when we get to work, we're basically putting hand sanitizer and going through the steps I listed here. And if anyone wants these slides, we can email them to you as well. Here's recommendations for the team is before coming to work. Like I said, keep your nails short, no jewelry, hair tied up, remove your watch and rings, avoid extra accessories, activate PayPal or some type of payment so you don't have to use credit cards anymore. That cross-contamination. In the laboratory, we actually invested in a washer dryer, so we're actually changing every time we leave the office. If we are going chairside, we leave everything at the laboratory. At work, obviously the PPEs, clean your headset with UVC light or disinfectant, and discourage cell phone use at work. Cell phone, as you know, are the most dirtiest things that we carry around with us and touch constantly. So after work, wash your hands, remove your scrubs. And I was also on with Gordon Christensen, and he basically said 95% of dental offices only operate in scrubs. And he said scrubs are your underwear for your PPE. Are not for every occasion. Those are your underwear. So just keep that in mind, and everything on top of, you have to put stuff on top of your scrubs. And then at home, don't touch anything. Remove clothes when you get home. Put them in a bag and shower immediately, right? You don't want to start hugging your kids right away when they run up to you and you may have something on you. Patient interviews and social distancing. Before a patient arrives, make sure you filter the patient, call them on their cell phone, ask them the questions, where they've been, do they feel okay, ask those type of questions. And if you want to go on his website, I believe he has a template of the talk track to ask the patients upon calling them before they come to the office. Promote your social distancing. I know most offices have taken the lobby chairs out. They removed all of them. The new waiting room now is in your car. So when your patient is ready to be seen, you would call them on their cell phone in their car and escort them the whole way through, meaning take their temperature, disinfect everything that patient touches, and just follow them throughout their whole appointment. Safety measures taken upon arrival. Like I said earlier, just make sure you wipe everything down. Follow the patient everywhere, even to the bathroom. When they're done using the restroom, you want to make sure you wipe everything down after they use it. So this is the same thing here, but this goes into more detail about taking the temperature, make sure it's below 100.4. Remove all the clutter. Reception room, even they have full PPE. So you got to keep your staff safe. Safe is the new norm in everything.
Before you move forward, I want to include a few things. Mark on floor for social distancing is very important now, because we don't know when other emergency patient comes inside office. So we have to mark and not only inside in a lobby area, but outside also, and in where we treat patient. So this is very important. Second thing, teledentistry is very common nowadays, and it's very helpful and very important. Like before we give appointment to the patient, we need to ask questions like, okay, do you have temperature? Like all those important questions we have to ask before patient comes. And then, of course, the waiting area, car. So as you mentioned, and when we cover our like gown or something, like we have to cover our neck also. That's very important. We don't care, usually we don't care, the especially all doctors even. So cover neck is very important. And sanitizer all the time in the pocket is the best way. And keep the cell phones away. So these two points are very important. And yeah.
Nice. All right, let me just move on here. Here's your just hygiene, right? Your PPE, eye protection gloves, and this is what Dr. Sayeedi was talking about. You don't want to show any skin. You want to have your disposable gloves all the way up to your wrist, covering the sleeve of your gown, right? Wear a hair bonnet, N95, face shield, even booties if you don't want to change your shoes after you leave the office. In the operatory here as well, just keep everything safe. Make sure you turn down that water, your Cavitron. I've been to some offices where the hygienist was had their face shield and it was just drenched with water. Make sure you turn the water down. That's something.
Sometimes we don't have control. Honestly, it goes fast. Like you don't even realize.
Right. And I know right now hygienist is one of the things that are really being looked at right now, because that Cavitron's always going and that produces the most aerosol in the office.
Yeah, exactly. Yeah, air droplet and droplets and aerosol, all because of this Cavitron. And like we move very fast, that the tip of that Cavitron. So we don't have 100% control on that. Like the water is gonna come out.
Yeah.
But protection is important.
Right. So basically, end of the day is just to keep everybody safe, right?
Exactly.
Keeping yourself, your patients, your team, because if anyone gets sick, just like at the lab, if someone at the lab gets sick, we all have to quarantine for 2 weeks. The lab can't even run anymore. So we're being extra diligent of making sure everyone is safe and doesn't get sick anytime soon. As right now, we're stage 2. Stage 3, as you know, all of these will open up the gyms, your movie theaters. I can get my hair cut. I usually shave my hair. I'm trying to grow it out, but it's been a month and a half, and it only grow like maybe 3 millimeters. Stage 4, your concerts, your conventions. We can have the CDA and ADA and all these Western Dental Symposium again, right? That was canceled. So stage 4, that should be hopefully coming up soon. What's the new norm? Like Dr. Sayeedi was saying, the new norm is teledentistry. I have a few doctors that are doing this now, and it really saves them a lot of time from seeing patients that have come in and they really didn't need to come in. So this makes it very efficient, makes it actually, the ratio of your production much healthier. So Peepee Wars, this is what your hygienist is going to look at. You're going to be all geared up. It's hot. I wore it last week, and it's hot. It's hard to breathe. And good luck going to the bathroom, because you really have to take everything off and re-glove, re-gown, and put everything back on. I also have a video of someone putting on their PPEs like they should, and it's a good almost 5 minutes long where they do everything. Even when they take it off, you actually have to wash your gloves as well.
When it comes to going to the restroom, uh, my suggestion, or what's like uh, um, sensor soap and sensor water tap, where you don't need to touch taps. So you
Yes,
just need to go under the tap and just wash your hands.
correct.
So that will be a good idea. And leave the first door, the front door, the opening door open, and then give some sanitizing or wipes inside restroom so they can use properly, and then they just wash their hand and come directly outside.
Correct. Even in the laboratory, we actually installed some foot door openers, I believe they're called, but it's
Mhm.
basically, it looks like a U shape on the bottom of the door. And
Mhm.
what you do is you don't touch the handle, you open the door with your foot.
Mm.
So it's almost
Even why not only sensors? Just go close by the door, and then the door will open.
correct.
Mhm.
Correct. So yeah, we can do that.
Mhm.
So here's some of the air purifiers that Dr. Ueno presented. I see a lot of commercials on Molecule now. And
Mhm.
basically, it cleans, it purifies the air. It has a HEPA filter, has a UV light in it. It's FDA approved, they say. And you can rent it or you can buy it. And since Dr. Ueno knows them, if you put Ueno saves MO15, you can get 15% off on the units.
Mhm.
So he has put some in his.
This thing is really important,
Mhm.
and uh, usually we think like, oh, it just sucks air. It's not only sucks airs, but uh, all the droplet, aerosol, airborne, it sucks everything, and uh, it cleans almost 99%. It removes all the particles from air. So this is very important thing in our offices now.
Correct. And this particular filter catches 0.03 microns, and that's the size of the coronavirus. And what happens, since it does have a UV light and some, I believe, some proprietary stuff in there,
Mhm.
it kills all the viruses that are on the HEPA. If you just have a filter with a HEPA and just air cleaner, um,
Mhm.
there's still viruses on the HEPA. It's not killing it, it just collects on there. So just be careful with that.
Yeah.
Here's what he installed in his office. Um, this is a fixed air scrubber. I have a friend that has one like this, but it's actually bigger, and he put it outside of the building, and it recirculates the air about 40 to 50 times in 1 hour. So basically, this is negative air pressure as well. So you have to make sure your operatories are just a closed room, not open. You can't have negative air pressure with an open room. It does purify the air, so the air going out is clean. So you're not spraying it dirty air out into the parking lot.
Mhm. Mhm.
This here is your mobile negative air scrubber. Basically, this goes in front of the patient's mouth and catches all the aerosols that are coming out. And I'm sure everyone's seen the videos of someone prepping a tooth and all the aerosols coming out the mouth. And
Mhm.
this catches everything coming out the mouth.
Mhm.
Dr.
It,
Sayeedi, you were talking about isolite as well,
yeah,
correct?
that's yes, because it sucks all the uh, droplet or aerosol right away inside mouth.
Mhm.
So I mean, it's an expensive thing, but now we should start that.
Yep. What about rubber dam?
Uh, some procedures we cannot even perform without rubber dams. So I mean, we cannot do all single fillings with rubber dam. It's gonna be too much for us. But if we need to, we don't have other option.
Mhm. Yep.
So we should start more and more.
Right. So you can have this along with your isolite, with your air scrubber, and also you can also put this in the room after every patient leaves. This is a UVC light medical grade that a lot of hospitals use, and it basically breaks down the RNA of the virus and kills it. It takes about 10 to 15 minutes to leave in your room after every patient. It's about 40% stronger than the UV of the sun. So you want to make sure you leave the room, and this is controlled by a remote to turn it on and off. You don't want to look at it. I know one thing, the concern is that your chairs. Move it around if you want to get to the back or the front, but I do believe it does sanitize everything that sees it or reflects off of it. I know it doesn't go through glass, so keep that in mind. Also, your leather on your dental chairs are going to crack prematurely because this is light, very bright light in your office, and your chairs are going to take a beating. You might have to reupholster quite often. In the laboratory, this is a bag, and here I'm basically showing you a cord that plugs into the cigarette lighter in the car. So when our pickup delivery person picks up the case, this is in the trunk. When they put the case in this box, we have UV lights in it to kill all the germs on the bags and on the lap slips. From there, we do an extra cleaning when we take everything out, obviously. But this is something that we added to keep our pickup delivery people safe.
Is it not dangerous for pickup delivery guys because it's a UV light and it's high frequency?
Correct. So this is in the trunk. So this is off. He'll open it up, put the cases in here. When he gets into the driver's seat and turns the car on, then he'll switch on the lighter, the cigarette lighter. And then it'll turn on when he's driving. Yeah, so he doesn't see this, excuse me, because it's in the trunk, and it turns on when the car is turned on when he leaves. So basically, that's all the presentation that I had, Dr. Sayeedi. I don't know if you wanted to discuss some other things that you had in mind, or if you had any questions on some of these slides.
First, like we have these slides, we are happy to share with anyone, any doctor, anyone. These are very important things, because what we are saying, Corona is not going anywhere in soon, because as we like yesterday I was watching news and they were discussing about new strain, because it's a DNA or RNA and it's changing shape, so it's hard to make vaccine. And so if let's suppose if Corona has 7 different shapes, we cannot make 7 different vaccines and give 7 vaccines to the whole world or everyone. It's hard. It's so hard and it's so dangerous. So my idea, like precaution first, and let's wait for the best result, because I know they're gonna come up with something like a special receptor or something on coronavirus so they can kill or at least stop spreading. So I don't know what's gonna happen in future. We cannot predict 100%, but hope for the best. I mean, I want the vaccine or any treatment come, but anyway, in our dental offices, we have to follow these steps. We have to follow all the protocol in order to, not only for us, our staff, for our patients also, because we know like sometimes like 30 to 40 patient, we see a lot of patients, like 30 to 40. My average is 30 to 40. So if I'm seeing 30 to 40 patients every day, then I have to be very careful. And I have to, until I'm not 100% sure or confident that I'm using or I'm doing all the things which helps my patient, then I don't need to. So I'm gonna make sure, like my office, my company gives complete information and like things to help ourselves and our patients, then I'm gonna start my practice.
Right. Right. Yeah, I agree. We have the PPE. I even have extra stuff that I bought on my own, right? Even in the house, I bought the UVC light. They're about $70 a bulb. I have one in each room. So when everyone is out in the living room or whatever, I close all the doors, I turn it on. So just extra precaution, you know, the mask,
That's
the
what we
wash
can do.
hand. That's all you can do.
Yeah.
You do.
Yeah.
Because we've been shelter in place. What happens when you shelter in place and we don't see anybody or out in the public like we were? Your immune system goes down, right?
Yeah.
Your immune system goes down. So when everyone gets back, just be extra, cautious of what you're doing, until your immune system builds back up again.
At the end, I want to thank our government also. There's government is supporting, like they have PPP plan, they have unemployment thing, and like so many things, and it's helping. Like we doctors, we are not getting too much benefit from this, but it's helping, and us also. We don't want, but it's helping us. Not only us, like all our staff, like hygienist or front desk assistant, sterilization area, like all. So, we should be very thankful to our government also.
Right. Yeah. And that's the reason, the laboratory we're going to work on May 18th as well. We got approved for the EIDL loan, right? The Economic Injury Disaster Loan. It's a $10,000 grant up to $2 million. It's a 3.75 annual percentage rate up to 30 years. So, that's a good thing. And that's so we can bring people back to work, right?
Yeah. Yeah.
So
I mean, they cannot kill all the viruses. They cannot finish this thing overnight. So at least something.
Exactly. So, yeah, I think that is it. Hopefully, I can see you soon, Dr. Sayeedi, in person. Chair side
In person, yeah. Are you gonna hug me? I don't know.
With the correct PPE.
Maybe, yeah. And then we have to change our PPE also.
6 feet or PPE.
Exactly. Yeah, thanks for having me here. And it was nice discussion, nice talking to you. And
same here.
Yep.
So with Western, I know that there's about 15 offices that opened in Texas, and I think you mentioned to me earlier that Texas is open, right?
Yes.
So Texas is up and running. So basically, that's why the laboratory is getting in gear as well. To we have accounts all over the country. So since every state's a little bit different, we basically have to open up now. We can't wait till June 1st, like the Bay Area.
Yeah. If you ask me personally, I'm gonna say I wanna wait until this thing completely finish.
Mm-hmm.
But I'm not. It means I'm not thinking about my other coworkers. They don't make that much money. They like, especially our assistants, our front desk, our patient care coordinator. So I mean, they live paycheck to paycheck actually. So in that case, like we have to think about those people also. So if we're gonna close forever, what's gonna happen?
Right.
They're gonna go broke.
Yeah.
So we have to think about opening with precaution, I think.
Yeah, I think we have to. And I think the stat too is that if a dental office is closed for 3 months, a lot of dentists will be filing bankruptcy as well. It's hard. It's hard. Hard. We've never been in times like this. So make the best of it.
Maybe in your area, because a lot of competition there in San Jose area, like a lot of dental offices, and even patients, they go shop around first before they
Right.
come. And yeah, I noticed in
Yeah.
this area we are okay, but especially
Right.
in Bay Area or San Jose.
Yes.
Yeah.
That's good. I mean, to leave off on a good note as well, is I have 3 people in my neighborhood that are dentists, and they're basically saying that the confidence of patients hasn't changed. I mean, they're getting calls like every day, like, when are you going to open? You know, I need my teeth cleaned, you know, and they want to do elective procedures. So from what I heard from the 3 of them is that the patients have confidence in going back to the dentist. They even know that the dental office or the dentist are number 1 at risk. So I think maybe they're over it. You know, they just want to see.
I think it's the 30% of the population, not everyone. My family, they are not going to make even a hygiene appointment next 1 year because they're very scared. And
Right.
including my parents, I'm not gonna let them go to that area because I don't want them to be exposed in that virus environment. So, like, yes, I know some people does not even believe in this.
Mhm.
So for them, they just want to open. They are like, okay, just be in a routine life.
Right.
So maybe for them only. I'm not gonna say like not everyone willing to or wants to open right now. But like some educated people, they understand this thing, and then they teach to their family and friends like, okay, how to manage or to do in this situation. So I'm gonna say like, okay, not everyone is planning to go.
Right.
And in private offices, I don't think they're gonna have full hygiene days for next 1 year.
Yeah, yeah, and I think the reason why is because I know these offices, and they have all the things I presented. They have the UV lights, they have the air scrubbers, you know, they have the extra suction in front of the face, and the protocols. Just as long as you have that, you know, then you give your patient confidence that you're doing more than what, you know, the CDC is asking or the ADA is asking, and it gives them a little bit more confidence.
Yeah.
So let's see if the spike goes up.
I do not know.
Time will tell, right?
Yes, I think so. Mm-hmm. But hope for the best.
Yes, for sure. And I think Western is June 1st, I believe, is the open date.
Everyone is different. Where I'm working in private office, they're open already. But for emergencies only for now. But soon, once they decided, okay, once the CDA, the Dental Board California, announced, they'll open. Like most of the private offices will open.
Right. So time will tell. We will see.
Exactly.
See what happens. All right. I think that's all I have for now, Dr. Sayeedi.
That's pretty much it. Yeah.
If I have more, more content, then maybe we should do another one. Keep everyone up.
Of course. Yes, of course. Yeah. Okay.
All right.
Thank you so much.
Okay. Thank you. We'll see you soon.
See you soon. Bye-bye.
Okay.